Hello and welcome to Chapter 11, where we're going to talk about different types of quantitative research. So Phase 1 clinical trials involve seeking opportunities for refinements and preliminary evidence of efficacy, true or false. So this is false. This is actually the definition of Phase 2 clinical trials. And really, when we look at clinical trials, there are 4 types of clinical trials, and typically the easiest way to think about them are in reference to drug trials. But keep in mind that clinical trials can include treatments such as pain management interventions, epidural blocks. So those might be the treatment. But if you think of clinical trials in the frame of med trials or medication trials, it's probably the easiest and most basic way of thinking of clinical trials. So there's really 4 phases of clinical trials, looking at really the clinical interventions and their effectiveness. So phase 1 is really the initial development of that drug or therapy. So sometimes, especially if it's a new drug, this will include sometimes testing on animals. Phase 2 is really looking at efficacy, and this definitely would be in humans, looking at a small group of individuals and looking at and when we think of efficacy, it's really about risk versus benefit and the benefits to the patient. So phase 3 is a full test intervention, usually a randomized controlled trial under very strict and controlled conditions. And phase 4 is really when we look at the medication or clinical intervention and its effectiveness on the general population. So inclusion and exclusion criteria will be broadened for phase 4 trials, looking at patients who maybe have comorbidities, where in phase 3 we were really looking at patients who have little comorbidity so that we don't get false results related to side effects. So there's 3 different types of clinical trials, looking at superiority trials, non-inferiority trials, and equivalence trials, and that's exactly the definition. So is the intervention superior to whatever the normal treatment is? They'll also look at whether that new intervention is no worse than the reference treatment, so looking at side effects, looking at cost, looking at burden to the patient, and then equivalence trials is 2 interventions are equal. And we often look at interventions in this frame of reference when one intervention is super costly, and if there's a equivalent option that maybe doesn't have the same high cost. Practical or pragmatic clinical trials really are looking at the practical questions of the benefits and risks of the intervention in a normal clinical practice. So is it something that's essentially doable? Is it doable for cost? Is it doable for the burden to the patient? When we think about burden to the patient, we often think about the time and effort it takes to be involved in the treatment. So physical therapy is a perfect example. It takes a little bit of a commitment from a patient, multiple appointments, but again, has a huge benefit when done correctly. What is the purpose of outcome analysis? Outcome analysis really describes the condition after the introduction of a program. And when we think about implementation or outcome science related to programming, we often think about how the program is in several different analyses. So how burdensome is the program to implement? Does it operate the way that it was intended? We were actually involved in a trial of a educational seminar, which has very low risks, but looking at the benefits of introducing palliative care earlier in a disease state and how that could have a positive outcome, that would be the objective, on our patients. And we really were looking at how easily is that program replicated once somebody goes through the original trainer. So it was a train the trainer study looking at program replication and its outcomes and the impacts that can be attributed to that program. There's always a cost or economic analysis. I wouldn't get caught up in the different types, but keep in mind that we're always looking for what is the benefit and then how much does it cost. Now keep in mind it's really hard to put a financial cost on human life. So if there is a huge benefit to the patient, then we're really looking at that cost benefits analysis. When we look at cost utility analysis, we're really looking at does it decrease morbidity and mortality. And then realistic evaluations really look at the, interventions in certain groups. So we know that not all interventions are effective for everyone, and that our diverse social and cultural contexts really do impact. So when we look at our studies, one of the things that you typically see in a study is a question about social and cultural backgrounds. Outcome research examines the quality and effectiveness of healthcare and nursing services. This is absolutely true. And one of the things that we struggle with in nursing research is that it's really hard to pinpoint one thing a nurse does to impact a patient positively. So we know that we take care of patients 24/7, and it's easy to say, okay, if we do X medical intervention, we give an antibiotic, it has X positive outcome. But nursing interventions happen 24/7, such as I think of falls prevention. Not one thing that a nurse does during that hospitalization prevents a fall. It's really the culmination of all those acts or the care that we provide. When we look at healthcare quality, there's so many pieces that kind of fall into the impact, such as the structure. The environment is a perfect example of structure. What does the environment look like? What does the lights look like when we talk about falls interventions? What is the physical environment like? What processes do we have in place? That has a huge impact on quality. We know that client risk factors impacts patient outcomes, and so we see that it's not just usually one thing that will impact nursing interventions. So you need to keep that in mind when you're setting up studies if you're involved in healthcare research. So there's all different kinds of research. One type is survey research. Pretty easy. We know that we can do personal interviews, telephone interviews, questionnaires, do a sample survey, and then do self-report. So these are just different ways of doing quantitative research using surveys. Other types of research includes translational research. It's really looking at knowledge into practical applications. So when we introduced bed alarms and chair alarms and toilet alarms, we looked at effectiveness and efficacy of those interventions on decreasing our falls rate. Implementation research really looks at programs, policies, and practices, and the description of that falls study, depending on what type of, how this study was set up, it may have been an implementation study. Again, it's not as important to know that, is it translational research or is it implementation research? Just know that research, quantitative research, can take many shapes and forms. I think we think of surveys as kind of being the gold standard to doing quantitative research, but a lot of research that is actually done in the clinical setting looks at, once we implement some type of intervention that we know is in the literature, what is its efficacy or effectiveness? You can also do a secondary analysis. So you might have collected a bunch of data, didn't plan on analyzing it in a certain way, and now you want to look at the data in a new way. You can actually take that data and do a secondary analysis, and it's an interesting way of looking at things, because there is typically you're doing a descriptive study just looking at the data that you previously collected, because you can't do an interventional study because you're doing essentially a post hoc analysis. Needs assessments is another way of doing research. So when we look at serving our communities, looking at the needs of the communities. What are the risk factors? I think of gun violence in Cleveland right now. There's a lot of research studies going on, looking at what we can do to prevent gun violence and the needs of the community. And then replication studies are exactly that. It's taking a study that has previously been done and replicating it to see if the results are similar or the same.